Thank you for yielding, Madam Chair, and to this panel for testifying on this important subject today. Dr. Omar, some clinicians had concerns that the U.S. Food and Drug Administration's recommended pause on the Johnson & Johnson vaccine might increase vaccine hesitancy and reduce public confidence in the overall approval process for the other vaccines as well. Dr. Omar, do you feel that the FDA's actions instill a higher degree of confidence in the safety of the COVID-19 vaccines that have received the emergency use authorizations from the FDA?
Yes, I think that was the right thing to do. As they were evaluating, they had a temporary pause, communicated the reason for that pause. Whenever you have an emerging event, there are several difficult options, but they chose the most appropriate, in my perspective, of those difficult options. So yes, in the long run, it will instill confidence in our vaccine safety and regulatory system.
Dr. Omar, can you comment on how common the severe blood clotting combined with low levels of platelets that resulted in the FDA's recommending a pause of the J&J vaccine? Would you say this is a very rare event? Could you comment additionally, please?
So depending on the group, it is rare to very rare event. And looking at the risk versus benefit, it heavily favors benefit. But then it was appropriate to evaluate that, take a pause, evaluate that risk-benefit ratio, and then resume the vaccination drive with this vaccine.
Dr. Omar, how does the rate of severe events for the J&J COVID-19 vaccine compare to other vaccines that we more commonly see people get? The chickenpox vaccine, the MMR that has been discussed previously in today's hearing, which have been proven to be safe and effective. So what's the rate of severe events comparing J&J's COVID-19 vaccine with other more commonly administered vaccines?
Well, it depends on the event, but overall, it is at par or favorable compared to other commonly used vaccines. So, I'd be happy to provide specific details based on the risk group and age group, et cetera. But I think it's reasonable to say that qualitatively speaking, or sort of broadly speaking, that this vaccine has similar safety profile, or in certain cases, certain groups, better safety profiles than some of our other commonly used vaccines as well.
Yes, I would like to see that additional data if you could, please. And then finally, Dr. Omar, on another subject, how common is it for someone to have an allergic reaction after receiving one of the COVID-19 vaccines? And is the risk the same among all three vaccines that have received the emergency use authorizations from the FDA?
So there are different databases that were used. It is also considered within the rare side effect range. And it is one of the ways this is mitigated, because right now we are in a situation where it is mitigated by having people wait an extra 30 minutes, extra 15 minutes, a total 30 minutes, who have, a predisposing situation, have a history of allergy, et cetera. So it is more in the context of mRNA vaccines, if you look at the absolute numbers, but even for mRNA vaccines, it is in the territory of rare events. So it ranges from, so there are a few ranges around that, but it is in the rare category even for mRNA vaccines.
And Dr. Omar, could you please comment for us, Dr. Omar, on the safety from your perch for the use of these new vaccines in adolescents and children?
That's a really good question. So based on the current data and the data that the Advisory Committee on Immunization Practices has evaluated, in the groups for which it is currently recommended, 12 and up, the benefits substantially outweigh risks. We continue to monitor events. There is a signal that various public health agencies, as you know, you may have seen in the news, that they are evaluating proactively. Just to remind everyone, it's a self-limiting event in certain teens, and I have confidence that we will get clarity on this event as well in the coming weeks, fairly soon.
And I thank you for that answer. My colleague, Dr. Schreier, the pediatrician on this panel today, I'm sure will also have questions regarding immunization in children. Thank you, Madam Chair, and I yield the remainder of my time.
Take the